Coalitions are really an interesting concept. This is a group of people who come together, sometimes representing themselves, sometimes organizations, that come together to accomplish some important task that none of them can accomplish on their own. So I'm Tom Keene. I spent many years in the cancer control field, had the opportunity to work a lot with coalitions of different kinds at the state, local, and federal levels, including the last 8 years with Sea Change, a national collaborative of leaders from the public, private, and not-for-profit sector devoted to ending the cancer burden as soon as possible. We've been blessed in this country because we have had support to create cancer coalitions in every state, as well as among a number of tribes in our territories and affiliated Pacific Island nations. That's a wealth of concepts and a wealth of organizations that had the opportunity to share information with each other, to talk about what they've done that's successful and how it might be applied in other settings and in different locations.
Comprehensive cancer control plans provide a roadmap for communities for addressing the burden of cancer in their communities. And the roadmap actually prioritizes activities. It describes who is responsible for doing what, and it provides an opportunity for the stakeholders in each community to own a piece of the activity that's going on to address specific cancer issues in their community. I am Nikki Hayes, the branch chief in the Comprehensive Cancer Control Branch and the Division of Cancer Prevention and Control and the National Center for Chronic Disease Prevention and Health Promotion at the Centers for Disease Control and Prevention. The National Comprehensive Cancer Control Program provides a coalition-based approach to convene partners in those communities to take a look at the burden of cancer in those communities, to assess the population health data that's available, and really prioritize activities that the players could take on collectively. And CDC provides funding to support the infrastructure for these coalitions. And the coalitions are convened of national, state, and local stakeholders who have a variety of different resources, be that fiscal resources, people resources, access to other people and/or activities, and they all come together to prioritize strategies for addressing the cancer burden in their communities. These priorities are articulated in comprehensive cancer control plans. The National Comprehensive Cancer Control Program priorities are 6, and they are: 1, to emphasize the primary prevention of cancer. This priority area gives programs an opportunity to plan activities to eliminate or reduce the risk for developing cancer. The next priority for the National Comprehensive Cancer Control Program is to support early detection and prevention activities. The third priority for the National Comprehensive Cancer Control Program is to address the public health needs of cancer survivors. We ask all of our programs to address primary prevention, secondary prevention, and survivorship challenges, issues, and concerns in their communities through this fourth priority area, which is through policy systems and environmental change approaches, understanding that we have a much more impactful approach when we are looking at things from a systems change perspective rather than from an individual perspective. The fifth priority area for the National Comprehensive Cancer Control Program is to address health equity. And then the final priority is to demonstrate outcomes through program evaluation.
I think what's really important in this issue, though, is to understand that every coalition is unique. And while coalitions are always eager, and I have seen them very eager to learn from what others have done and what their success is, the issue then becomes, how do we take that idea or that concept and actually do it better for ourselves in our own environment where we have our own unique set of circumstances, perhaps our own unique set of cancer problems. And in the case of cancer plans within coalitions, we probably have our own unique set of priorities, some of which may or may not fit into what we hear as successful things to do. So this idea of constantly learning from each other and having the capacity to do that with the infrastructure we have in this country, I think is a substantial opportunity. But then ultimately, you always have to bring it down to the level of the people in your coalition and the way they work best together, what their priorities are.